So today we'll be discussing about a very interesting topic, that is hyperkalemia versus hypokalemia. So we must know in hypokalemia, the the most important things in hyper versus hypokalemia is, in hypokalemia what we get is a very low voltage ECG. This is the first finding that which we can get. The second thing, the most important thing in both hyper and hypokalemia is T wave. So we always have to look for the normal T wave. So we must remember, normal T wave is positive, is dome shaped, and is asymmetrical. But in hypokalemia what we get is, the first thing which we get is a flat T wave. Then as hypokalemia worsens or lesser is the potassium level, we can get T wave inversion, and if it worsens we can get ST segment depression and the low voltage ECG. These are the four very characteristic features of hypokalemia. We'll be seeing this here. So when we try to see it in here, what we can see is, if you try to see, there is basically T wave is not there. So this is the R wave, this is S, and then there is no T wave in here. If you see, the T wave is very small in here. The T wave here is inverted. So if you see, in everywhere we don't see very prominent T wave. The T wave is very small and it is very flat. The ST segment is almost completely flat. So the baseline is flat. So this is the first ECG where we don't see any good positive T wave. T wave is almost flat. So if we see some other ECG here also, if you can try to see the T wave, if we see anywhere, the T wave is not there very well. The T wave is not very well there. The T wave is not here. The T wave is not at all there. So T wave is almost flat or it is absent. If we see in here, the one more interesting finding of hypokalemia is presence of U wave. Now, as in alphabetical order, we always get U wave after T wave. That is the reason why it is U wave. U wave is seen in anterior leads, meaning we will be able to see it from V1 to V5 or V6, mostly up to V4. And it will be after the T wave, and it will be a positive wave after T wave. So if you can see here, T wave is not here, T wave is not here, T wave, you will not be able to see any T wave. If it is present, it is very small. See, in anterior leads, this positive deflection is T wave. And just after that, what we get is U wave. So this is U wave. This is U wave. So as I told, you will see this from V1, V2, V3, V4, we have very good U wave. In V5 we have very good U wave, and in V6 also we have very good U wave. And the other findings, like the T wave inversion is there, and there is slight ST depression. So presence of flat T wave, inverted T wave, and presence of U wave very classically suggest hypokalemia, and we should always think of hypokalemia whenever such findings are there. Now when we come to hyperkalemia, in hyperkalemia things are very well defined. For example, we can exactly come to know what could be the potassium level. So we know the normal potassium is between 3.5 to 5.5. So as soon as the potassium rises from 6 to 7 milliequivalent per liter, then what we get is a typical finding, which is tall, symmetrical, tented, peaking T wave. What does this mean is, whenever the potassium is between 6 to 7, we get a very tall, symmetrical, tented, peaking. Peaking means the T wave will be like a arrow. So just see this. This is the perfect T wave of hyperkalemia. It is tenting. Tenting means it is sharp. The tip is sharp. The tip is not dome shaped, and the dome shaped T wave is a feature of a normal T wave. But in here we can see it is tenting. It is becoming arrow-like. Symmetrical. How do we come to know symmetrical? Just take the tip of this T wave and just draw a perpendicular. So we see two boxes are here and two boxes are here. This is what we mean by symmetrical T wave. But whereas in normal T wave, what we get is we get U wave like this. So normal U wave, there will be asymmetry. There will be more boxes here and less boxes in here. But in hyperkalemia, what we get is a symmetrical T. So exactly almost similar number of boxes will be there whenever it is hyperkalemia. So whenever potassium is between 6 to 7, we get tall tented symmetrical T wave. As the potassium level rise between 7 to 8, what we get is loss of P wave. There is loss of P wave, and the QRS, then it widens. These are the two features which we can see as soon as the potassium rises in between 7 to 8. So what we see is here, we can see the P is not very well present here. P is not at all very well. In here P wave is there, but it is not very prominent. So what we can say, in this ECG, this particular ECG, patient must be having potassium of around 7 to 8 or around 7. So, and once the potassium rises to 8 to 10, then patient can anytime have ventricular tachycardia or ventricular fibrillation or cardiac assistole. This thing can happen, and as the potassium rises more than 9, anytime the patient will have sine wave pattern. Sine wave pattern means on the ECG you will not be able to see P wave, QRS wave, to T wave. You will be seeing, you can see this type of pattern. This is called sine wave. This sine wave, it means that the muscle is not at all contracting and the muscle is, myocardium is not at all functioning well. That presence of VT, ventricular fibrillation or sine wave is an indication of cardioversion. So we'll see some few more examples. So in here we can see that the T wave is very nicely tall. See, there is again a very tall T wave and it is peaking arrow-like. It is arrow-like. There is no P wave. There is no P wave. Even if it is there, it is very small. You try to see it in here, but the P wave is not at all there. The P wave is not at all there. So you can see the P wave is not there. The T is tall, sharp. The P wave is not very well visible here. It is there, but it is very small. It is very small. It means the potassium must be 6 to 7, and as the P is getting lost, means the chances are very high that the patient has potassium of around 7 to 8. As we can see, the QRS is already white. If you see the QRS, if you can see the QRS. So Q is starting here. So there is one box. This is the second box, and this is the third box, and this is coming up to 3.5 box. So QRS is 3.5 box, means it is around 140 milliseconds. We know more than 120 milliseconds is a wide QRS complex. So QRS is wide, P is lost, means the patient must have potassium of at least 7 to 8. If potassium rises more than that, then the patient can anytime have VT, VFib or a systole. So this is one more example of hypokalemia. What we can see in here, the QRS complexes are very small. So to call it as low voltage, what we need to know is in chest leads, that is V1 to V6, the QRS must be less than 10 millimeters, and in limb leads, that is AVL, AVR 1, 2, 3 leads, the QRS must be less than 5 millimeter. So in here it is more than that. So this is not absolutely low voltage, but it is kind of low voltage, as there is the T waves are very small. You can see there is T wave is not at all there. There is no T wave in here. If it is there, it is very small. It is very small. In here the T wave is not there very well. It is very small. So this is again one more very good example of hyperkalemia. You can see that T is very tall, symmetrical peaking. P wave is not, it is there, but it is kind of small. And there is one more finding in here, that is, we can see this is P wave. You can very well see this is P wave, this is P wave, this is P wave, this is P wave, this is T wave. Now, after this P, the next P is here directly. So P is not there. The P was supposed to come here, here, and it has appeared here, but the P has not appeared here or here. So this is one of the example of sinus pause. What is sinus pause? Sinus means SA node. So in between, sometimes the SA node doesn't function. It gets a pause. So there will not be any P wave. No P wave means no QRS complex. And we call it a sinus arrest when the same things continues for at least 3 seconds. This is one more very good example of hyperkalemia. You can see the T is tall, sharp, arrow-like. P wave is not there. So, and QRS, if you can calculate, so this is the Q, here, this is the first box, this is the second box, and this is the third box. So there are total 3 small boxes, means 120 milliseconds. So 120 seconds or more than 120 seconds, we call it as wide QRS complex. So P has lost, QRS is wide, T is tall, T symmetrical peaking, means the potassium must be in between 7 to 8. So these were so many beautiful examples. This is one of the very good example of hypokalemia. We can see this is V1, means this is V2, this is lead V3, this is lead V4, and these are the limb leads. See the QRS. QRS is very small. It is less than 5 small boxes, less than 5 small boxes. This is less than 5 small boxes. In V1, V2, V3, they are almost, even if it is like more than 10, but almost all the leads, they fall into the criteria of low voltage ECG. So P, the T wave is very small. You can see the T is very small. Here it is very difficult to see the T wave. Here it is very difficult to get any T wave. T wave is not there. And here the presence of U wave is there. And there is ST depression, ST flattening. So these are all very good examples of hypokalemia. So this is all for today, and thank you for your kind listening. Have a good day.